All right, we are live.
Hello, and welcome to today's collaborative webinar, Transforming Substance Abuse Care, Exploring Whole Person Care Platforms to Elevate Mental Health Outcomes and Provider Impact. I am Dr. Patrice Little, the founder of NP Student, and I'll be guiding the discussion today. And I'm so excited to welcome our two incredible leaders from two entities who have been doing some transformative work. We have Kwan and Anaki, Vice President of DME Connected, Therapy Connected, who provide an overview on mental health and how Connected integrates their services with companies such as the Recovery Village. And following that, you'll hear from Mike Middleman, Veterans Affairs Coordinator with Advanced Recovery System at the Recovery Village, who will highlight one of their programs and share a high level story of impact. Now, as we embrace the new year, many of us providers have been reflecting on what can we do better to improve our patient outcomes as well as transform some of the services we provide in healthcare. And this often brings us to a question as in, what does it mean to transform care? Just think about it. Transforming care, it can mean anything from prioritizing patient centeredness, advancing health equity, integrating technology such as DME Connected, fostering collaboration, improving outcomes, and addressing social determinants of health. So, what I would like for you all to do as you tune in is to really reflect on these ideas and drop a comment in the chat because we want to make sure this is interactive. And which one of these approaches most resonate with you and why? And this is why. If you are considering particularly transforming care for when it comes to substance abuse and dependency, there are some other things to consider, such as the actual person, and that's what we're going to focus on today. It's important to consider recognizing the interplay between the mental health and substance dependency, also known as substance use, ensuring that patients receive their comprehensive, compassionate care that addresses both their physical and emotional needs, and last, building systems that reduce the stigma and prioritize long time recovery. Again, this question of transformation is especially relevant as we look at mental health and substance abuse care. And today, we'll move forward with exploring how whole person care platforms, such as the Recovery Village and DME Connected, are driving change and elevating outcomes for patients while supporting providers such as yourself. So let's get started. We'll begin with Kwan. Thank you for joining us, and the floor is yours.
Thank you so much for having me, Patrice. We look forward to these webinars. This is the second of a multitude of webinars that we'll be having. So each month, stay tuned to our webinar series. So what I want to do is I'm going to allow Mike to speak on the Recovery Village. Mike is a member of Therapy Connected, one of our partners, and I want him to just introduce himself and give some more information about what the Recovery Village is and how he helps the clients that comes to his program. Fast over to you, Mike. I'll tie everything back in after Mike is finished.
All right, awesome. Well, I appreciate it, and thank you, everyone. It's great to be here. I appreciate the opportunity to share information and introduce myself. So I'm going to go ahead and share my screen. Just have a few. You did want me to go through my presentation now. Just want to make sure. Okay, perfect. So I'm going to go ahead and share my screen. So again, my name is Mike Middleman. I'm with Advanced Recovery Systems, or you'll see a lot of our programs referred to as the Recovery Village, and I'll dive in a little bit more on that. But just wanted to share, a quick story. Actually, I'm going to unshare for a second just so I can talk through a quick story real quick. About 3 years ago, actually 3 years ago, MLK weekend, I've been in this field for about 8 years, but about 3 years ago, I received a call from one of my best friends. He was struggling. It was actually from his wife, and she said, he's he's ready for treatment now. So it was really cool to kind of spring into action, know exactly what to do. He had a unique insurance that not a lot of places accepted. But I was able to look at that insurance list, address the situation, and identify the most appropriate place for medical detox from his alcoholism at the time. So he's coming up on 3 years clean. It was just really cool to save her probably multiple days of calling around to treatment facilities, not really knowing the exact questions to ask. Meanwhile, the insurance company had provided 6 facilities and only one provided detox from alcohol. So thankfully, it was a reputable facility near where we lived, and we're able to get him the help and keep his family and his kids and everybody together to this day. So he's 3 years clean this week, and it's just like a really really cool thing and an honor to be in this field. He didn't come to my facility, which is perfectly fine. I just like to tell people, if you hear of mental health, you hear substance abuse, call me, and we're going to figure it out and get that person to the appropriate resource as quick as possible. So with that being said, like I said, I've been in this field for about 8 years now, and I think the screen is sharing. Can you all see there it is. All right, perfect. So yeah, been with Advanced Recovery Systems 3.5 years. We have a national footprint of behavioral health facilities covering inpatient mental health and inpatient substance abuse care. Most notably, I know a lot of people on this call are from the Atlanta area. We have a facility in Roswell that I'll touch on as well as we go through the presentation, and opening a second facility in the region in Stockbridge later this year. So, just like to share this first slide. These are our two founders, Dr. Mitchell Eisenberg and Dr. Lewis Gold. They are physicians by trade and have kind of passed that on down the line with every facility we open. We're a physician-led, physician-run organization, um, which we take great pride in. We have full-time medical staff, full-time clinical staff at all our facilities. Each medical director is a psychiatrist. So we bring a lot of the co-occurring mental health for our substance use clients. We're able to treat a lot of that. And it's just a really great full continuum of care model that is physician led. Our providers and medical doctors, they're in the facility 7 days a week. So it's not somebody, coming in here and there, signing a chart, leaving. Maybe you don't see them till the next week. Our people are full time, which is really nice. So patients are able to see those doctors depending on the level of care, every day or, a couple times a week, just depending on what the situation's calling for. But they're always on site and they're always available. Um, really important when it comes to treatment. I mentioned my buddy who had a random insurance that a lot of um, organizations didn't accept. So this is just a quick snapshot. We take many other insurances that may not be listed here. A lot of the big ones in the commercial space might be like Aetna, Blue Cross, Cigna, United Healthcare. Most recently, we went in network at a few locations, including Atlanta, with TRICARE. And we also take VA benefits. So VA, if veterans have a certain insurance, maybe they have a Blue Cross, or oftentimes we'll find where a veteran has Medicaid or Medicare, depending on their service connection and VA benefits, and of course approval from the VA, we can actually admit veterans with an authorization from the VA to our treatment facilities. We've been able to work with the Atlanta VA and a few others around the country to get our service members and veterans into our care, which has been a really very just cool partnership. The veterans, sometimes they want to stay at the VA. Other times they want to change the scenery, and that's where Recovery Village comes in to be able to treat them. So just if you don't see your insurance listed here, or insurances that people you come across have, doesn't mean we don't take it. We have a very quick verification process and admissions process. So if somebody had an insurance that might work with our facilities, they would call. We run a verification of benefits, and then maybe do a 15-minute screening or so on the phone to try to get them in. If they're in a hospital or other medical facility, the admissions process might look a little different. But either way, we'll work very quickly to make sure insurance checks out, clinical and medical check out, and then set people up for, same or next day admission. This just talks a little bit about our model of care. As I was alluding to in the previous slide, the first thing we want to do is assess and treat. So we want to make sure that that person is appropriate. We don't want to take someone just to take them. We want to make sure that we are the best fit, both clinically and medically. We're going to collaborate on site to make sure our medical doctors and clinical team is moving them along through the various levels of care that we offer, because each of our facilities do offer multiple levels of care. And then, as they step through the rehab program, make sure we're using the latest and greatest in evidence-based treatment modalities. And then a really important step, even when they're not with us anymore in our facility, is that discharge plan. So we work with a lot of providers, both locally and nationally, to make sure that people have that outpatient service when the time comes, not just on the mental health and substance abuse side, but some people come to us and they're like, I haven't been to my primary care in 5 years. We'll make sure to set them up with a primary care appointment or whatever else that they need. We want to make sure that we're treating that person as a whole and that we're getting them to the appropriate next steps. It's just as important as the actual treatment itself. If there's no if there's no aftercare plan in place, a lot of what we're doing at the facility, while it's great treatment, we want to make sure it sticks. So setting people up with the most aftercare possible is very helpful. Regarding this slide, this is a full continuum of care, something we take really great pride in with people who come to our facilities for treatment. So I mentioned my buddy earlier. He needed detox. He was drinking alcohol. Alcohol is one of the most dangerous things you can come off of, especially if it's not medically monitored. Quitting cold turkey, it's very dangerous. You're at risk of a seizure and other medical complications. So when it came to him, somebody like him would admit direct to our detox level. Ideally, step down. It could be a combination of detox or what's known as intensive inpatient. Intensive inpatient helps with the co-occurring psychiatric diagnosis that might be going on. Maybe somebody needs medication adjustment or medication prescribed. So that's a lot where that detox and or intensive inpatient could come in. Or if somebody's in a situation where maybe they are not on alcohol or not on a drug that requires detox, they could step directly into our substance abuse residential program. From there, a lot of our programs have what's called partial hospitalization. Typically, partial hospitalization or PHP is a day program. So some people, if they've been to another program or aware of other programs, oftentimes this is a day program where people go home or maybe to a sober living at night. Ours is a little unique and different because we actually offer an on-site boarding component so people can live with us while in PHP. And that's really where we see our outcome rates and successes shining, is because people are in that structured environment, prior to stepping down to intensive outpatient and outpatient. Typically, when they get to the outpatient level, sometimes they're still seen by our providers, but usually we're stepping them into a community partner at that point. On the right-hand side, we do have the mental health component. A lot of our facilities, Stockbridge, which is opening in April or May, will have the mental health residential side. We have 5 others as well scattered throughout the country. And I'll share my information in the chat. Anybody interested, I'm certainly happy to blast out our information to anyone, just so you kind of have an idea on our national footprint. But Stockbridge will have mental health residential along with additional detox beds. We have mental health residential right now in Indiana, Columbus, Florida, and we have a really cool firefighter program in Maryland that treats primary mental health as well. Just a fun side note about that program, and one of the things that drew me to the organization 3.5 years ago, our firefighter program is an exclusive partnership with the Firefighters Union, which is called the IAFF. So we've treated over 3,500 union firefighters at that facility since opening about 7 or 8 years ago. So it's just a really, really cool partnership with that union. This is kind of just a thumbnail, just so you get an idea on where our facilities are. As you can see, the gold is Stockbridge, which is coming online in the near future. We're actually opening a second IAFF program in Southern California, just given the need that a lot of the firefighters have had. And then we're opening another facility in Salem, Oregon this year. But all the blue facilities are where we're currently open and active, with any and all levels of care. At the bottom shows a couple of our insurance awards. That's basically the insurance company judging us on our outcomes, and something we take great pride in is, people uh, not coming back to us. It's always a double-edged sword when somebody calls my phone. It's great they're reaching out for help, but at the same time, something's going on that requires some assistance, usually just a certain diagnosis or usage, and um I love helping people, and we hope treatment takes the first time, and we have a very low recidivism rate compared to the national average, very high success rates compared to the national average, and just something we take true pride in, our success. This was just some kind of stats I pulled from SAMHSA website. SAMHSA is a helpful tool that people can it's almost like Google for treatment facilities, where people can um, find programs in their area. This was just some data they had. But basically, the long and short of this is substance abuse and mental health. It affects a lot of people, and not just the person that's going through whatever they're going through. It affects the family, it affects the friends, it affects the job, it affects, all aspects of life. So, you see these numbers on here, you can probably multiply by 10 the amount of people that are actually affected, just, within that person's orbit, probably 10 at a minimum. So, we have family therapy, we have group therapy. If the person wants the family involved, certainly something we're always happy to engage, and something we strongly encourage. So this is just some data I'd pulled from the SAMHSA website. This next slide talks about, alluded to the readmission rates and recidivism rates that I touched on. This bottom right chart showing a lot of the follow up and the aftercare that we're always making sure to have. People are always getting aftercare, the PCP appointments, the mental health appointments, whatever they need. We want to make sure they're, um, you know, getting that to keep them on a long or healthy track for clean lifestyle, and just set them up for the greatest chance of success. Um, so I apologize. I know that was a lot of information. I hope I didn't, blow through that too quickly. This is all my information, which I'll share in the chat as well. And we have the full continuum of care nationwide. And again, truly appreciate the opportunity to be here, and cannot stress enough that, if you hear nothing else from what I said, if you come across anybody encountering a mental health or substance use struggle, please reach out through DME. Please contact me directly. Always happy to jump in the mix. And, even if we're not the right fit, similar to what I did for my buddy, um, always happy to get people connected where they need to be. So, again, thank you all very much. I'm available for any questions, and I'll turn it back over to the team here.
All right. So I do have a couple of questions. There were some things that stood out, and I know those who are tuning in may have feel the same as well. When you mentioned that you guys offer family therapy, which is amazing because that really increases their chances of not coming back. So I'm pretty sure that helps with the impact with the recidivism. How is it covered insurance wise for that when you involve the family?
Yeah, so it's part of when somebody admits to us, we'll always get a release of information sign. So a lot of the questions around their admission will be, do you want your family involved? If so, who? Maybe it's not a family member, maybe it's a close friend, or something of that nature. And um, when we admit somebody, we always make sure we're in network with their insurance. So that helps keep costs down. The family therapy is all part of the treatment program. Everybody's insurance policy is going to look a little different, whether it's deductibles, co-pays, co-insurance, out of pocket, stuff like that. So we always make sure on the admissions process to let them know what, if any, out of pocket costs they're looking at off the bat. So we're all on the same page. But if they're able and willing to have the family member as part of the treatment process, we'll make sure to set up those family sessions, as soon as appropriate.
And what's your average length of stay, Mike? And as far as accommodations, do you guys provide any accommodations to get a client to your treatment centers if need be?
Yeah, so length of stay can vary. It really depends on the clinical necessity and the person's willingness to be there. Um, we have all the levels of care I walk through, but people might come across somebody who says, "Oh, I have work or family obligations or whatever the situation is," and they say, "I can't go, 30, 45 days. I can't go into treatment for 30 or 45 days," which normally we're about the 30 to 45 typical length of stay. But if you get somebody who says, I can't be away for that long, we can do just the detox component. And that'll allow somebody to at least get safely somewhere, to get that alcohol or whatever they're using safely out of their system in a medically monitored setting. Um, some people, they'll complete detox and say, "Hey, I said detox only. I'm out of here. Set me up with aftercare, and we'll do that." And other people say, "Oh, I have a clear head, clear body now. I want to. I like it here. I want to stay for residential." So we do see it both ways. But to answer that, we could see somebody for 3 to 10 day detox,
Mhm.
up to 30 to 45 days if they decide to stay for the full continuum of care. And then, as far as transportation goes, we do partner with Uber Health, which allows us to engage a HIPAA compliant driver very quickly, and pick up from the greater Atlanta area to get to our Roswell location. Um, we'll actually go up to 250 miles. So if somebody is outside of Atlanta, depending where they are, we'll try to figure it out.
Mhm.
If they're
That makes
somehow out of that radius, I'll do everything I can to engage like a nonprofit partner or family or friend support. Last thing I want is transportation being any sort of barrier for them, safely getting into treatment.
right. Okay, and we do have another questions here. As far as alternative payments like care credit, do you accept?
Care credit, I'm not familiar with that off the top of my head, to be honest. But if somebody, we do have a self pay that we work with as well. So depending on what length of stay is agreed upon or what they're looking for, we could certainly mention, or we could certainly have the conversation about what a payment plan might look like. So self pay does get pretty expensive, but certainly happy to have that conversation on what potential out of pocket costs would look like when it comes to that. We
Okay,
do have the detox option only for that as well versus the full continuum of care.
perfect, perfect. Okay, so now I'm going to go into how this all ties into DME Connected, Therapy Connected. So once again, I'm Quan Aniki, VP of DME Connected, Therapy Connected. We started DME Connected around about 6 years ago. Therapy Connected is a part of DME Connected. DME Connected is the parent company of Therapy Connected. I came to my team and I mentioned to them that I saw that there was a need for a mental health component to be a part of our offering. And so the team agreed. And so we started Therapy Connected. Therapy Connected is about a year old within our Omni channel. I am going to go into a quick demo so you actually see how Therapy Connected works and how our partnership with the Recovery Village and other, say, treatment facilities or therapists happen to take shape. So let me share my screen here, and I'm going to try to do this in about the same time as Mike. Uh, okay, here we go. Hopefully you can see my screen. All right, and I will just bring it up a little bigger. Okay, so this is the omni channel of DME Connected, right? This is where you would sign up on the platform, right? And access our platform itself. This is where you can do your searches for medical equipment or services. So doctors can order medical equipment and services directly through our platform and have it delivered to their patient. There are several criteria that we offer as far as search is concerned. So you can go through supplier, manufacturer, search by patient insurance, um, and supplier service areas. Now, what we're here for today specifically is Therapy Connected. So, Therapy Connected is added here as another way in which the doctors can also find the right therapist for their patient. And this is going back to what Mike said about he met with somebody who had not seen their primary care provider in a while, right? So, we have actually helped with taking that or removing that barrier with adding the EHR system. So we are integrated with several EHR systems that allow the medical providers or the doctors to actually send that patient directly to a therapist through their portal. You click on Therapy Connected, right? And this is what the doctor would go to as far as finding therapists. So these are some of the therapists that's on our platform currently. Here is Mike. Click View. You're able to see Mike, Recovery Village, all the information about the services, right? This is what the dashboard would look like. Let me show it to you here. Um, Okay. So this is your dashboard. So and once you sign up to the platform, this is what a therapist would receive. So if you're able, once a doctor send you an order or send you a client, you're able to see the client information. You can see pending orders, accepted orders, or rejected orders through our platform. So we made it very intuitive so that it's easy for you to receive a patient, look at the order itself, and see if it's a patient that you can accept. If you can accept that patient, well, you would reach out to that patient, see if it's somebody that you can accept. And if you can accept it, you said yes, and you can send that information back over to the doctor's office and let them know that you're accepting that patient, right? Um, Once you become a part of the platform, this is where you would sign up to join Therapy Connected, right? You put all your information here, pertinent information. This is where the magic happens. We need to know your expertise. What services do you provide? Right? Are you CBT, DBT, trauma focused? You would submit that to us and make your payment. Once that is done, when you are now part of the Omni channel, you're part of Therapy Connected. We also have a front facing side of Therapy Connected. This is for the general public. So the general public also now have access to you as well. So if somebody, the average person just need to find your services, they can also join or visit Therapy Connected and find a therapist. Once you are part of the Omni channel, you are also automatically included in our front facing side of Therapy Connected. Right here is some of the folks that we actually have on our, and here's Mike again as well. Okay, so basically, this is how it all ties in. We are a platform that allows the medical providers to find therapists and recommend therapists directly through our platform. It's really just that simple. And of course, I'm going over it at a fast pace here. But so if you need any more clarity, please reach out to me. I'm willing to do a one-on-one demo so you can actually see how it works um, in real time and answer any questions that you may have. I am going to stop sharing. Okay.
And thank you for that, Quan. While you were presenting and providing that awesome overview about the different components of DME Connected, Therapy Connected, we had a question in the chat. They wanted to know if MDs only have access, and how do therapists, can't see that last part of the set, how do they access the therapist as far as the directory?
Okay, does MD Okay, so once the MD is signed up on the platform, they have direct access, so they can see the therapist directly through their dashboard because each MD will have their own dashboard, and it's free for the medical provider, so there's no reason for them to say no, right? So they can get on there, and if they have a patient that come into the clinic, or it's a primary care doctor, or let's just even say it's a specialty care, and they have a patient that needs some sort of help when it comes to mental health or some substance related disorder, then they can actually go onto the platform itself and they can recommend that patient by giving that patient the information directly, or they can go on to their system because we're connected with EHR system, which is your electronic health records.
Mhm.
These are some of the big ones like Epic, Advanced MD, eClinical Works. So if they're tied into that system, they can automatically grab that patient information and send it directly over to a therapist.
Okay. Thank you for that. And then just to clarify, what I did and put in the chat also mentioned that a variety of providers can actually have access, not just MDs, including nurse practitioners, physician associates, which were formerly known as physician assistants. And then also, we'll put in the chat where you can also sign up. You can sign up for free, and so just be sure to sign up. And as Quan mentioned, you can also book a demo and he will help you with navigating the platform.
Yeah. So the medical providers receive the platform for free.
Yes,
For
therapists.
professionals and therapists, it
Yes.
is it is a annual subscription fee
Mhm.
that you pay, very nominal to what you would pay for like a psychologist today or something like that. We have just made it easier. I think our EHR integration is what we pride ourselves on most, because of course it allows the doctors to be able to place that order directly through our platform if that patient is actually tied to the EHR system. And we know that most therapists, treatment centers, they're looking for that connection directly to doctors' offices, right? We just went a step further and made that connection easier,
Mhm.
right, for them to be able to have that exposure.
One of the things I want to emphasize for those who are tuning in is that when it comes to DME Therapy Connected platform, you literally take out a lot of the wasting of time. You improve the efficiency in being able to identify providers that are in the network, and just the fact that you mitigate that. Sometimes people don't understand how just amazing this platform is. Can you share a little bit about some of the type of feedback you have received from those who are part of the DME Therapy Connected family?
So one of the things we hear the most is what you just alluded to, is the fact that it does cut down the amount of time that it takes for them to actually find the right provider, right? So we have it where you can search by criteria, right? That's why we have 4 different criteria you can search by, right? Whether you have insurance or you're self-pay, or if you're out of state, it doesn't matter. We could find you the right person for whatever the needs that you're struggling with, whatever you might be struggling with. We could find you the right person. And I'll go back to even what Mike said. Sometimes we may not be the best, the best fit. Excuse me, I'm tongue tied. But at some point, just give us a try and see what's available to you. Right, the access is there. The cost is very, very, very minimal, and then we are growing consistently with adding more and more providers, and more vendors, more and more therapists, right? So it makes it easy for you to find the care, and it's just a few clicks away. We made it 3 easy steps for you to be able to access the care that you need. So the biggest feedback that I get is the fact that it's the ease of use, right? The sign up process is very easy. It's a few agreements that we have you sign up for,
Mhm.
and you have access to our database. And oh, at this point, we have over 200,000 plus medical providers that we're integrated with.
And one of the things I like about the platform, it's very user friendly.
Yes.
So we appreciate it.
So we like to say it's an Amazon-like feel. If you know how to navigate Amazon, you can navigate DME Connected, Therapy Connected.
So let's shift gears quickly, going back to the therapist services and also the recovery village. For the therapists that are sign on or subscribe to the Therapy Connected platform, can they do like a provider to provider, like therapist to recovery village or therapist to therapist, depending on the specific needs of their client?
Yes, yes. And that's something we're building out even more so because we wanted to make it a peer engagement
Okay.
platform as well. Meaning, if you can't accept that patient and you have somebody within the platform that you know that can take that patient, you can send a message direct to that person or send that patient over to that person. And then it's up to that individual to say, yes, I can accept that patient, because we must understand that sometimes they may not have the accommodations, right, or the vacancy to accept that patient at the time. And but to be able to do so is actually available.
I'm going to go back to Mike because there is a burning question that I have, and you may have addressed it, but I just want to make sure we bring it up again for those who are tuning or just joining us now. You mentioned the different types of the patients that you provide services for as far as the substance dependency, but wanted to know a little bit more about the age. Is there a particular demographic? Is it adult only or is it adolescents? Which, can you tell us a little bit about that?
Yeah, so right now we are all 18 and over. Unfortunately, we don't have an adolescent or child program in our ecosystem. But again, going back to the anyone with mental health, anyone with substance abuse needs. I mean, I've gotten calls from families with very young children before, and they need resources, whether it's just an outpatient mental health provider, or maybe depending on certain behaviorals, maybe they need an inpatient setting for the child or adolescent. Always happy to get people connected, regardless of the situation. But as far as our programs go, it goes 18 and over for um, substance abuse or mental health or co-occurring.
Okay. And then I remember you also had mentioned, I believe it's called SAMHSA, as far as another resource they could go to for those who are tuning in if they need additional resources, that's where they can go as well.
Yeah, so that's another place where you can locate treatment providers. I just pulled some data from their website. They are a government organization. Um, some of it's user friendly, some of it's not as user friendly as DME Connected. So I would certainly say try DME Connected, try calling me. If you have to use SAMHSA, of course, it's there if you need it. Um, but similar to what I did for my friend, I was able to cut out a lot of the noise and get him connected to treatment immediately. Which everything's about speed with this, because the window of willingness is so little for so many people that are struggling. And the quicker we can get them the support they need, the better off everything's going to be.
And so, piggybacking from what you just said, Mike, I have a question here. Can therapists refer patients to the Recovery Village through DME Connected? And the answer is yes, they can. They can, because the Recovery Village is on Therapy Connected, so they can actually go on there and request services directly through DME Connected.
And another thing that Mike had emphasized as far as that short window, as far as that window of willingness, many of those who are tuning in, they are not aware that January 2025 just happened to be a inaugural time. Particularly, it is Substance Use Disorder Treatment Month. So this is why we really wanted to kick this off, because we understand that window of opportunity, and just wanted to just emphasize once again about the different ways and incorporating the whole care. But Quan, did you have anything else to add, or Mike, before we close out the webinar?
For me, I thank you all for joining us today. Give us a try. I always say, give us a month try at least, right? And see if we are that platform for you. We are still a work in progress. We are growing exponentially each day, adding more and more therapists to it. And I put out as much information as I can to let you know that more therapists are needed, more treatment centers are needed, right? If you need to reach out to Mike, you can go directly through our platform to schedule a meeting or get a client over to him, depending on what the criteria is for that client. In the meantime, if you need to reach out to me, you can reach out to me directly. I'll put my information into the chat. And thank you so much.
Thank you, Mike.
No, it's great. I appreciate, everybody taking the time today, and um, we're here if you need us. So again, just any mental health or substance use situation you come across, don't hesitate to reach out. And um, there are no bad questions. And even if it is just a quick question, feel free to reach out.
And so again, I on behalf of the team, I thank you for joining us, and just wanted to reinforce that just the whole transforming care is a part of the process when it comes to caring for our patients. I encourage each and every one of you, to really explore the additional solutions that DME Connected has, and as far as that, how it can enhance your practice, improve patient outcomes, as well as drive revenue. I want to also finish with that. So for more information, just schedule a demo. And like Juan mentioned, he'll put his information in the chat. Visit dmeconnected.com and
or therapyconnected.net.
or therapyconnected.net. And also be sure, for those who are new to the whole DME Connected, Therapy Connected family, follow us. And we have more webinars like this in store. And be sure to let us know if there's a topic you would like us to highlight and how we can serve you. So take care. Till next time.
Thank you so much. Have a good one.
Thanks, everyone.
Bye bye.